Good day, everyone. From the platform of MDI and in collaboration with Diabetes Wellness Center, DWC, we welcome you all to this informative sessions where we'll be talking about diabetes. And there will be different topics on diabetes. Our first topic for today is with our pediatrician, Dr. Amir Daud, who's a community pediatrician, and he will be talking about type 1 diabetes. So thank you very much, Dr. Amir Daud, for coming here. My first question for you will be that what is type 1 diabetes?
Type 1 diabetes is the commonest type of diabetes that is present in children. More than 70% of the cases of diabetes mellitus in children are caused by type 1, which is also called insulin-dependent diabetes mellitus. It is different from the other diabetes which we commonly see in adults, which is called type 2 diabetes. So that is the difference between type 1 and type 2, and we'll talk about
Yeah,
it.
definitely. So type 1, we say in children, is totally insulin-dependent diabetes. So Dr. Amir, why do you call it as an autoimmune disease?
This disease is caused by an immune reaction which causes a destruction of beta cells of pancreas, leading to partial or complete destruction of the cells and leading to deficiency of insulin. And because of this immune reaction, which is triggered by different viruses or environmental factors in genetically predisposed individuals, that's why it is called an autoimmune disease.
Right. So I'm sure that a lot of parents or public out there who had this question that what is the main difference between type 1 and type 2 will now understand more clearly. So tell us something about the honeymoon period in type 1 diabetes.
As we know, as we discussed, that type 1 diabetes is insulin dependent, and the mainstay of treatment is insulin therapy. When we start a treatment with insulin, after a few weeks of therapy, a time comes when suddenly we find that insulin requirement starts to come down, blood sugar starts to come towards normal, and we feel that the disease is improving. And this is called the honeymoon period because it may last for a few weeks to a few months, during which there is very little insulin requirement. But we have to be very clear that this is not a cure at this stage. This is a temporary period. And we will find that at some stage, blood sugar will start to rise again, hemoglobin A1C will start to rise again, and insulin requirements will increase again. And then, so during this honeymoon period, there is an adjustment in treatment, diet, and insulin dosage is required.
Thank you so much. I mean, this is a very, very important point, and all the educators for the pediatric group, they focus on this, that once a newly diagnosed type 1 diabetic child comes into their clinics, they make sure that they explain the honeymoon period to the parents and to the child if they are of an age that they can understand that honeymoon period is only a transient period and nothing else. So, Dr. Daud, how would you define or how would you explain the importance of insulin in the life of a diabetic child?
So again, we will have to compare between diabetes in children as with the diabetes in adults. In children, the type 1 diabetes, there's destruction of pancreatic cells, and so there's a gross deficiency of insulin. So insulin is the mainstay of therapy because if we don't use insulin, sugar will not be controlled and it will lead to a lot of problems. This is different from the diabetes in adults in which insulin is present, but the cells are not able to utilize that insulin. So insulin is the mainstay of treatment in type 1 diabetes. Oral sugar lowering agents that we commonly use in adults, they are totally ineffective in dealing with children with diabetes mellitus.
That is wonderful because most of the parents think that they keep on requesting the pediatricians and the endocrinologists that please give tablets to our children. Why can't our children have tablets instead of insulin? So for all of them, you have given a wonderful answer that insulin is the life for type 1 children. So do not hesitate to start insulin and to monitor your children on it because this is the fuel, this is the energy that they require.
So just I'll add one thing, that these oral medicines usually try to increase the sensitivity of the cells to insulin. But in type 1 diabetes, there is no insulin present.
That's
so
very true.
This will be totally absent.
Yeah, thank you
This
so
is
much.
totally ineffective.
So, if I would like you to sum it up and to give a public service message, what exactly would you like to tell the public about type 1 diabetes per se, which will be very important for them to know?
One thing is that type 1 diabetes is the commonest type of diabetes present in children, and it has two common peaks. One is between 4 and 6 years of age, and second around puberty. And secondly, insulin treatment is the mainstay of management, along with the dietary and lifestyle changes. And it is very important to control the blood sugar into normal range, because high blood sugar for a long time can lead to nerve damage, kidney diseases, vision problem and blindness, heart diseases and stroke. So it is very important that we do regular blood sugar monitoring, keep in touch with your doctor and a diabetic nurse if there is one, so that you are able to monitor the dose of insulin and manage your sugar levels at an optimal level.
Thank you very much, Dr. Amir Dao.